Hi, my name is Thessa. I'm a relationship-centered care coordinator at Nightingale Hammerson, and I want to tell you a little bit about hand massage. The idea behind it is to really find connection, especially with someone living with dementia. As their world is maybe getting a bit smaller, as speech is getting difficult, and their senses are changing, it is nice to reach out through touch. People with dementia might rely on touch a little bit more. Maybe someone wasn't at all touchy throughout their life, and now they are, and you're not sure what to do with that. But a hand massage can be a first attempt at fulfilling that need for that person. You don't have to be an expert. There is lots of techniques that will link for you, but the most important thing is to take a deep breath, to be a little bit aware of our own body language when we offer the hand massage, and to not start touching someone without consent. If you know that someone doesn't speak anymore, you might just gently touch their hand and see if they pull away. That is a form of consent as well. A really nice thing is to reverse roles as well and give that person opportunity to maybe give you a hand massage, so they're not always just the recipient of care, but that you give them a bit of autonomy. It's best to use a cream that they're already using, or a very neutral massage oil, maybe like grapeseed oil, which is very easy to get. As you're doing it, really look at the body language of the person to see if they find it pleasant. That is especially important if they can't tell you. Music really helps with setting the atmosphere. If you're doing it in the morning and you're using it as a gentle way to wake someone up, maybe you do a little bit more of upbeat music. If you're doing it to relax someone before bedtime, maybe classical music. But again, try and find out what the right time of day is for the hand massage for that person and how you set up the room comfortably for them. You could use a diffuser with just a little bit of water and some essential oil in it. When someone is nauseous a lot, maybe they're going through chemo, you might want to just be careful with a lot of different smells and a lot of perfume. Again, it really depends on the person. There are some diffusers that also have nice glowing lights that could be quite nice to set up in the room. Take into account that some people with dementia do have hallucinations and get a bit frightened when it's dark. It is important to not overwhelm someone. They might not be used to these things at all. They might not be touched in that way in a long time, especially if someone is in care. They get touched kind of in a medical way all the time. So maybe a hand massage is a bit scary. Introduce it slowly and maybe don't do the essential oils and the hand massage and offering the tea at the same time, because you might see someone kind of shy away. And the conclusion isn't then it didn't work, but maybe we just did a little bit too much. And that's okay, because we, as the person trying to give this form of affection, we're learning as well. And we're getting to know that person in a different way now. So it's okay if maybe the first time they pull their hand away from you. Doesn't mean you could never try it again. Maybe just one thing at a time. It is a lovely way of connecting, really helpful with pain management. You know, you can see someone's body change. It helps with sleeping. It helps with relaxing, but most importantly, it helps with connecting with each other through touch.